In this video, we'll be discussing about a very important procedure that is very commonly done in neonates, that is orogastric feeding tube insertion. So, orogastric feeding tube insertion is usually done in preterm neonates like you see here. Okay, so these preterm neonates who are born between the gestational age of 28 to 31 weeks, usually we do orogastric tube insertion in them because for feeding also it is required, for medication administration. Okay, and orogastric tube insertion can also be done sometimes in other neonates, term neonates also, if they are having intestinal obstruction or features of necrotizing enterocolitis. Okay, so what are the supplies, what are the things that we need for orogastric tube insertion? You can see in this tray all the things that we need. Very very important to gather them all together, because otherwise it will be difficult for you to do it. So first we need, of course, a orogastric feeding tube. You can see, so 5 to 6 French size is the one that we usually use. Here we are using 6 French size, you can see there. Okay, apart from that, what else would you need? So we will need a pair of sterile gloves. Okay, we will need some adhesives to fix the tape. We will need a 2 ml syringe. Okay, so I'll tell you why the syringe is used when we come to it. So basically it is for confirming the position of the orogastric feeding tube. Okay, the adhesive tapes, like I told you, it is required. So a measuring tape is required to measure up to what distance the orogastric feeding tube should go inside. Okay, and a stethoscope again is required for confirming the position of the orogastric feeding tube. So very important first step is to measure. So can you see, we are measuring from the nose of the baby, okay, to the earlobe. So nose to ear, and also we have to go up to the stomach, remember? So nose to ear, and then we'll measure up to the abdomen of the baby. So up to the abdomen, so in the abdomen we'll measure at midpoint between the umbilicus and the xiphi sternum. So you can see the marking of 18 centimeter, we have to go up to 18 centimeter in this baby, okay? So for this baby, the length of feeding tube insertion required is 18 centimeter, but it will vary from baby to baby. So again, you have to measure in each baby from the nose to the ear, from the ear to the abdomen. Okay, like we did here. So we held the feeding tube in the sterile gloved hands. Okay, though the marking is not very clear, but you have to identify the marking 18 centimeter mark for this baby, and then we'll proceed to insertion. Now, very important is to flex the head of the baby slightly. So see, if you're not flexing, you can face some problem while insertion. So just gently flex the head of the baby, okay? And then smoothly go inside, okay? So if it is going smoothly without facing any obstruction, gently go on inserting the orogastric feeding tube till you reach the 18 centimeter mark, okay? And that mark will of course vary from baby to baby. So here we've reached the 18 centimeter mark that we had measured for this baby, okay? Now, before fixing the tube, okay, what we will do, we will confirm the position. So how do we confirm the position of the feeding tube? So we will use the 2 ml syringe. We will take some air in it. We will put it on the hub of the feeding tube and we will push the air. Along with that, we'll put the stethoscope on the epigastrium or abdomen of the baby and hear for the whoosh sound. So see, we are pushing and hearing for the sound on the epigastrium. Okay, so once we are able to hear that sound, we are sure that the feeding tube has reached the stomach. Okay, there are other ways of confirming the position also, like you can aspirate the contents of the stomach. You will see some curdled milk coming out, and you can even check the pH of the gastric contents. It should be less than 6 if it is in the stomach. Okay, now, baby keeps on moving his hands like this, hands and feet. So he will just pull out the feeding tube unless you fix it very nicely. So what we'll be doing now is fixing the feeding tube. Okay. And obviously it has to be fixed very properly. And when you fix, you have to see the 18 centimeter mark, which we had decided for this baby. So we have to fix it at that point. Okay. Because we've already confirmed and we had already measured it. In this baby, it should go up to that distance. Okay. So you see the mark and accordingly you fix it. And before giving each feed, you should check this marking, okay? Because if this feeding tube has got displaced by chance, then there are chances of aspiration of feed in the baby, okay? The baby can cough, choke, and can even have aspiration pneumonia, okay? And so on. And once you've fixed it, again you will confirm. See, so again we are confirming the position of the feeding tube, okay? And you can take help from your friend or a nursing staff also, and you doubly make sure that the feeding tube is in place. So again you are pushing air, okay? You can see we are again pushing air and we are confirming by hearing that whoosh sound, when you are pushing the air in the syringe. Okay, now we are sure that the feeding tube is in position, okay, and it can be used for feeding a baby as and when required. So this is a very, very important must know procedure which all of us must know about. All right.